Good afternoon. Like Ashley said, my name is Alison Baker, and I am the pharmacy manager for our employee pharmacy, and I also supervise our student pharmacy that's on campus and a pharmacy in Montgomery that's for state employees. So many of you, if you use the employee pharmacy, I may have met you before, but we're going to go through just some basic information about the services that the pharmacy offers, as well as our pharmaceutical care clinic, and services that you may be currently using, or if you're a newer employee, you may not be aware of yet. So we'll go through those first, and then we're going to touch on at the end a few things that a few changes that'll be coming up for next year that will affect pharmacy services as well as our AUPCC. All right, so just a little background information first about the employee pharmacy. So we are a full service pharmacy. So anything that you are currently having filled as far as prescription medications at a local pharmacy, whether it's a retail chain or whether it's a independent community pharmacy, the employee pharmacy can provide those services for you on campus. And it is very convenient because we're located right in the heart of Central Campus, inside the Harrison College of Pharmacy. The pharmacy was established in 2006, and we exclusively serve employees of the university and their dependents. So if you are an employee of Auburn and your spouse and children or other dependents are covered on your Auburn University insurance, then you're eligible to use the pharmacy services. The pharmacy does offer quality services for our patients. We make sure that any prescriptions that are sent from your doctor's office are safe, effective, the most affordable options, and that they're conveniently available for you. And here recently, we've been met with some challenges as far as medication shortages. So we're always here to help our patients find alternative ways to get medications if we're not able to get them as well. All right, so I'm just going to hit on a few benefits of using the pharmacy and our services that we can offer you. The biggest thing I think for most people is that you can save money by using the employee pharmacy. So the employee pharmacy is going to be the preferred pharmacy for our Auburn University insurance plan. And what that means is that your copays for generic medications are going to be lower than if you were to fill them at another local pharmacy. Many generic medications are actually free of charge if they're filled at the employee pharmacy. Whereas in comparison, if you went and filled at another pharmacy in town, you may pay a $15 copay or even more than that. So depending on what medications you're taking, that could definitely be beneficial for you and saves a lot of our patients a significant amount of money. And again, just to reiterate, that is with our current PPO insurance plan. Another benefit is saving time. So I mentioned the location of the pharmacy, that it's very convenient. But we also offer free delivery on campus. So if you work on Auburn's main campus, you can choose to request delivery to your work location. The delivery is free of charge. We do ask that you allow 2 business days for those to be received, just to allow the pharmacy staff to prepare the medication if it needs to be ordered, and get all of that organized and ready to go out to you. We also have a private consultation area at the pharmacy. So for counseling patients on new medications they're starting, or if a patient has a question, you don't have to ask questions where you're in the waiting area where there may be other patients waiting, and you can discuss issues with the staff without being overheard. All right, another service that we offer is what we call medication synchronization. So what we usually call it for short is MedSync. And basically it's kind of self-explanatory, but it's a program that works to sync up your medication refill. So if you're taking more than one maintenance medication, it helps to sync those up where they can be refilled on the same day, either each month or every 3 months if insurance allows that medication to be filled for 3 months at a time. So it makes it much more convenient, also helps with adherence, just being able to come in and get everything at one time, and saves you trips to the pharmacy as well. The employee pharmacy is also classified as an approved specialty pharmacy for our insurance plan. So what that means is if you're on a specialty medication, which a specialty medication is often something that is more expensive than many medications, and for a specific disease state. It's often an injectable type medication. A lot of them are refrigerated and they're very expensive. A lot of insurance plans do require them to be filled at specialty pharmacies, which are often mail order. So if you're currently getting a specialty medication that you have to get through mail order, you can actually opt to change it to the employee pharmacy and get it on site, so you don't have to have it mailed to you. So for a lot of our patients, that's much more convenient. They don't like having to wait for it to come in the mail, and a variety of different things. So just something to keep in mind if you're on one of those types of medications. Our pharmacy also offers an after-hours service. So what that means is, because the pharmacy is not open at night or on the weekends, we do have an on-call pharmacist that's available 24/7. So we always have a pharmacist on call, and if there's a medication emergency or an urgent matter that needs to be handled, they can handle that outside of normal business hours. You can call if you just have a question about a medication that was picked up, and they can help you with that, even if the pharmacy is not open at that time. All right, so just a few notes on how to start using the employee pharmacy if you have not before. So it's pretty simple. We have a new patient form that you'll fill out. You can get that from our website. There's a fillable form there. You can just type in your information, and then you can email it to us, or you can fax it to us, or drop it off at the pharmacy in person if you're going to be by there. You can also complete the form at the pharmacy if you prefer to do that on your first visit. So if you've never used the pharmacy, you go to the doctor and you ask them to send your prescriptions there. When you come in the first time, we can get you to fill out that form on the first visit, if that makes it a little easier for you. And then from there, that form will give us all the information that we need to contact your current pharmacy and transfer any active prescriptions that you may have refills on, so that we can start filling them at the employee pharmacy for you. All right, a couple of extra little notes, some different things that some patients may not be aware of. Auburn University employees who retire before the age of 65 can still continue to use the employee pharmacy for their prescriptions. If they have the PHIP retirement plan and they're under the age of 65 and they're insured through the university, then they can still continue to use the pharmacy, and will process their PHIP insurance instead of their previous Auburn University insurance. Do keep in mind with that prescription copays and medications that are covered will look different because PHIP coverage and copays are different. But if patients prefer to continue to use the pharmacy at that time, they can do that. Another thing to note is that Auburn does have a lot of employees that work in other places within the state. And so if you're an employee that works or lives in Alabama, but are not in the Auburn-Opelika area, you could be eligible to receive your prescriptions through the mail. So if you fall into that category and you might want to utilize our services, just reach out to the pharmacy staff, let them know where you are, and they can look and see if you're eligible for that as well. All right, this slide right here just has some of our location, contact information, phone and fax, and email if you need to send in anything to us. The website is there for you as well, where you can access the new patient form and all of our services. Our hours are here as well. I do always like to point out that our hours on Thursdays are different from the rest of the week. So on Thursdays, we don't open until 9. And then the phone number for the on-call pharmacist is also listed on this slide, and it's also posted on our website. And then we do ask that if you are someone that uses Instagram and or Facebook, that you follow our pharmacy page at AU Employee RX. We post lots of pharmacy updates, if there's days that we're going to be closed, if there are just things going on in our department that might be of interest to you, we post all those things there, so we'd appreciate that.
All right, so before we move over to talk about the Pharmaceutical Care Center and the Healthy Tigers program, did anyone have any questions specific to the employee pharmacy? We are going to discuss at the end of the presentation the changes that we are currently aware of with a high deductible plan, if that's something that you're looking at changing to. But if there's any general questions regarding the employee pharmacy, raise your hand or type them in the chat now, please. Okay, are you able to unmute and ask your question? If not, you can type it directly to Alison Baker in the chat.
Okay, you just typed it.
Yeah, I
Okay.
can unmute also.
Okay,
Perfect.
go
Yeah.
ahead.
Yeah, I guess my question was, will you ever get a website for refilling and to be able to see your prescriptions and everything online?
Yeah, that's actually a really good question. So the answer is yes. We are actually in the process. Our current system that we've used for years for requesting refills, where you basically your only option is to call in and dial in your prescription number over the phone. We are transitioning away from that, and we're going to be implementing a new system, hopefully in the next couple of months. So it's in the last kind of planning stages and making sure everything's working just how we want it to, working out some little kinks and things. But basically what that will allow is exactly what you mentioned. It'll allow you to access a portal via a website where you can request refills, and you can look at your prescription history and what you do have refills on. You can also check and see if you have prescriptions that are currently ready and what the copay is at the pharmacy, a variety of things that right now, the only way to find out is if you call the pharmacy. So you'll be able to handle a lot of that on your own with that new system. So it is coming down the pipe pretty soon. So look forward to that.
Hey, great question. Thank you. And if there's not any other questions, we will go ahead and continue. The AUPCC is an interdisciplinary clinic that is located inside the Harrison College of Pharmacy. We actually share a waiting room with the employee pharmacy. And our healthcare team works closely with your doctors and other healthcare providers, as well as the employee pharmacy, to help manage your health conditions. Healthy Tigers is probably the most common practice that we do that the main portion of campus is familiar with. The Healthy Tigers is the wellness program that HR offers. It is a benefit for employees who subscribe to the AU health insurance plan and for their spouses or adult sponsor dependent. And so the biggest misconception we get is adult sponsored dependents do not include adult children. So that is a question we get often is my child's 20 years old. They do not qualify for the Healthy Tigers benefit. It is only employees and their spouses or that adult sponsored dependent. The wellness screening includes a blood sugar reading, blood pressure, cholesterol, and then a height, weight, and body composition. And the results of the screening are typically available within 10 to 15 minutes. So our clinician will go over the results with you, discuss anything that you have questions about, and most importantly, all results are kept confidential. So your Healthy Tiger screening results are not shared with anyone. It just stays in our secure medical records files. Common questions are, when am I due for a screening? Screenings are done once per calendar year, not academic year, not year to date, but January through December. And so all paperwork must be received by the second Friday in December to ensure that there's no lapse in benefit for the following year. Screenings may be done here in the clinic. We also do off-sites around campus at AUM and also at several ACES locations around the state. So you do have several opportunities and locations to get that screening performed by us in the clinic. You also have the option to have that screening performed by your healthcare provider if you're having these labs done every year. Just be aware that not all of the tests are covered by insurance every year if you don't have a certain reason to have those labs run. And so you may incur costs at your physician's office. When performed by the AUPCC, there is no charge to you for that visit. The screenings take approximately 15 minutes, depending on the number of questions that follow. May take a little bit longer, but typically 30 minutes you're in and out for your screening process. If you are a new employee, or if it hits January, you weren't screened this year, it's going to be basically like you're starting that screening process over. It can take up to 60 days for all the paperwork to be processed by our office and payroll. But once that deduction starts, if you're paid bi-weekly, the deduction is on the second paycheck of the month. Monthly employees, obviously, it's just that one paycheck. And the screening benefit will cover the remainder of the current year and all of the following year. So for instance, if you do not have the university's insurance right now, but you're going to enroll for January, you cannot be screened until January. And so that discount will kick in by March. And then that discount will cover all of 2024 and all of 2025. And so then you would just come in 2025. Cannot believe I'm saying these years. And 2026. So we do have some zones for the screening values. And if you have certain values for your blood pressure, blood glucose, or cholesterol, you may receive a referral to your physician. We must have that referral form returned back to our office in order for that discount to start. If you're a new employee, if you were screened the previous year, we just must receive that referral form by the second Friday in December for the discount to roll over without lapse. Other services that we offer: medication checkups, medication therapy management, medication monitoring. So basically you can meet with one of our physicians, bring in your medication list. Our pharmacists can look over your med list, ensure that there's no gaps in care, that you're not taking a brand medication if there's a generic option, and just ensure that all the medications that you're taking are doing what they're supposed to. We also do some disease state monitoring. We have a diabetes and you education classes. So if you're a newly diagnosed diabetic, then you can meet with our pharmacist to discuss any questions that you may have. You check to see what that question in the chat is.
I have a chat here, but I don't see one.
Okay.
Let me pull it though, just make sure.
So in addition to the health and wellness screenings for Auburn University, we also are contracted to do the state insurance screenings, PHIP screenings, and the local government insurance screenings. So if you don't have the university's insurance, if you're on your spouse's plan who has one of those three plans, you can do your wellness screenings with us here. We also offer TB skin testing. So if you are taking classes and a TB skin test is required, we do offer those here in the clinic as well. We also offer immunizations per CDC guidelines. So any approved vaccine we can administer here in our clinic to anyone ages 12 and older. So if your children need vaccines for school, as long as they are 12 and older, we could administer those here in the clinic as well. We also offer a Pack It Up smoking cessation program and Healthy Habits, which is a weight management and cardiovascular risk reduction program. Few other things that we do that just aren't as common, but we do offer them. Women's health consultations, my goodness, I'm sorry. We have a drug information department if you have questions regarding specific drugs. The medication cost analysis services, like I said earlier, if you're taking a brand medication, we can check to see if there is a generic that would be an equivalent to help save you money. Also, we offer just point of care testing. If you just want your blood sugar checked or your blood pressure checked, you can just walk. Typically for those, you can walk in, and if we have a clinician available, we could do those for you. And then, like I said, we're located in the College of Pharmacy. We share a waiting room with the employee pharmacy. And we do close at 5 o'clock, Monday through Friday. And just like the pharmacy, we do not open until 9 on Thursdays. But if you ever have any questions for the clinic or Healthy Tigers, there is our phone number and our email addresses. And then we are also on Instagram and Facebook if you are on social media.